In a groundbreaking move that promises to reshape the healthcare landscape of Burkina Faso, President Ibrahim Teore has launched a massive $24 million health equipment initiative. Imagine the impact. From bustling urban centers to the most remote rural villages, a new era of healthcare accessibility and quality is dawning. But what does this mean for a nation often grappling with healthcare challenges? How will this investment change the lives of millions? Let's dive deep into this transformative development and explore how President Traore's vision is set to revolutionize healthcare in Burkina Faso. Burkina Faso, like many nations in West Africa, faces significant healthcare challenges. The country struggles with a high burden of diseases, such as malaria, tuberculosis, and HIV/AIDS, coupled with limited access to essential health services. According to recent statistics, the country's infant mortality rate is around 47 per 1,000 live births, and the average life expectancy is about 62 years. These figures highlight a critical need for improvement in healthcare delivery and infrastructure. Rural areas, in particular, bear the brunt of these challenges. While urban centers like Ouagadougou and Bobo-Dioulasso have relatively better healthcare facilities, rural regions often suffer from a lack of resources, inadequate medical staff, and poor infrastructure. The disparity between urban and rural healthcare is stark, with rural residents facing significant barriers to accessing quality healthcare services. Before we continue, just a gentle reminder to like and share our videos. Also, subscribe if you haven't done so, to stay informed on the latest African economic, political, and social developments, and explore how global geopolitics impact the continent. I urge you to watch this video till the end so that you will see real reactions from around the world from social media users, which will encourage you to react to this video too. Now let us continue. Major health issues affecting the population include infectious diseases, maternal and child health complications, and malnutrition. The healthcare system struggles with insufficient funding, outdated equipment, and a shortage of trained healthcare professionals. This context underscores the importance of President Traore's recent investment in health equipment, which aims to bridge these gaps and provide equitable healthcare access across the nation. President Traore's health equipment investment is a monumental step towards addressing Burkina Faso's healthcare challenges. Valued at an impressive 14 billion CFA francs, $24 million USD, this initiative marks one of the most significant healthcare investments in the country's history. But what exactly does this investment entail? The equipment package includes a wide array of vital medical resources designed to enhance healthcare delivery across the nation. Key components of the investment include 13 refrigerated vehicles. These will revolutionize the storage and distribution of vaccines and other temperature-sensitive medical supplies, ensuring they reach even the most remote communities in optimal condition. 15 mobile clinics. Equipped with state-of-the-art medical devices, these mobile units will bring essential healthcare services directly to underserved populations, eliminating the need for long and arduous journeys to distant hospitals. 11 cold rooms and 2,900 solar-powered refrigerators. These will ensure that vaccines and medications are stored safely, even in areas without reliable electricity. 3,000 tablets. These devices will facilitate efficient data management, improve healthcare administration, and enable telemedicine services in rural areas. Compared to previous healthcare investments, this initiative represents a significant leap forward in terms of both scale and impact. It underscores the government's commitment to prioritizing health as a cornerstone of national development. The potential impact of this health equipment investment on rural communities cannot be overstated. With the introduction of mobile clinics, healthcare is being brought directly to the doorsteps of those who need it most. Imagine a mother in a remote village, no longer having to travel miles to get her child vaccinated, or receive prenatal care. These clinics are equipped to perform crucial services such as mammography, ultrasound, and cancer screenings, addressing critical health needs that were previously inaccessible to many. Refrigerated vehicles and solar-powered refrigerators will ensure that vaccines are stored and transported safely, even to the furthest corners of the country. This improvement in vaccine and medication storage means that children in remote areas will have access to life-saving immunizations, drastically reducing the prevalence of preventable diseases. Furthermore, the deployment of these resources will significantly enhance emergency response capabilities. In cases of medical emergencies, time is of the essence, and the ability to provide timely care can mean the difference between life and death. These mobile clinics and vehicles will enable faster response times, potentially saving countless lives. Overall, the increased access to healthcare for remote areas promises to close the urban-rural healthcare gap, providing equitable health services to all citizens, regardless of their location. Technology plays a pivotal role in modernizing Burkina Faso's healthcare system. The introduction of 3,000 tablets will revolutionize healthcare administration, allowing for better data management, patient tracking, and coordination among healthcare providers. These devices will also facilitate the implementation of telemedicine, enabling healthcare professionals to consult and diagnose patients remotely, bridging the gap between urban specialists and rural patients. Solar-powered refrigerators are another technological marvel included in this investment. In a country where electricity access can be limited and unreliable, these refrigerators ensure that vaccines and medicines remain effective even in off-grid areas. By harnessing solar energy, these devices provide a sustainable and cost-effective solution to preserving vital medical supplies. The potential for telemedicine and remote diagnostics is particularly exciting. With the ability to connect with specialists in urban centers, rural healthcare providers can offer more comprehensive care, improving patient outcomes, and expanding the reach of medical expertise across the nation. The economic and social benefits of this healthcare investment are manifold. Firstly, it is expected to create numerous job opportunities in the healthcare sector. From medical staff for the new clinics to technicians for the maintenance of equipment, this initiative will bolster employment and contribute to economic growth. For families, reduced healthcare costs will be a significant relief. By bringing healthcare services closer to communities, transportation costs and time away from work or family will decrease, easing the financial burden on households. Moreover, improved healthcare outcomes are likely to increase life expectancy and enhance the overall quality of life for Burkinabe citizens. Healthier individuals can contribute more effectively to the workforce, boosting productivity and economic development. The ripple effect of better health outcomes extends beyond individuals to the broader society. As health improves, communities can thrive, education levels can rise, and poverty can be reduced, creating a more prosperous and resilient nation. The international community has responded positively to Burkina Faso's bold healthcare investment. Healthcare experts and organizations worldwide have lauded the initiative as a model for other developing nations striving to improve their healthcare systems. Social media has been abuzz with reactions, with hashtags like #BurkinaHealthRevolution and #TraoreHealthcare leading the conversation. Many users have praised President Traore for his visionary leadership and commitment to the well-being of his people. Comments from around the globe highlight the admiration for Burkina Faso's proactive approach to healthcare. Quotes from prominent healthcare organizations emphasize the significance of this investment. For instance, the World Health Organization commended Burkina Faso for setting a new standard in healthcare delivery, while UNICEF highlighted the potential for improved child health outcomes as a result of the initiative. Now let's share some of the reactions from around the world. From Togo, an admirer says, I am Togolese and proud to call him my president. I am now Burkina Faso. Long live my president. From Ivory Coast comes this contribution. With only 14 billion, look at the work. If it was here in Ivory Coast, we would be told about 1,000 billion. Thank you, Captain, for what you do for your people. From Burundi, here is a true patriot, a strong man throughout Africa, a visionary man. I love him a lot. Here is a coup d'etat of the people by the people for the particular expectations, with particular precision specified of your great people of our Faso. Thanks. The land of honest men, impeccable general, tremendous respect, tremendously. Thanks. This one is from an unknown country. My heart is filled with joy. Thank you for everything, President. You are a true leader, and you are surrounded by good people. You have put together this winning team. And now, from Benin Republic says Burkinabe people, please protect for us our continental darling, President Ibrahim Teore. If you ever neglect it, we will judge you. Long live President Ibrahim Teore for life. Patrice Talon from home, please come and get a little inspiration from the work of your younger brother, Ibrahim Teore. I will add that Patrice Talon, that is referred to here, is the President of Benin Republic. I am Comorian. Ibrahim Teore is my president, not the dictator Azali. May God protect Ibrahim, our president of all Africa. Now it is time for us to add a disclaimer. Please, you should note that the opinions expressed by these social media users are strictly theirs and not ours, and we quoted the words they used without editing. Here comes another one. When you love your country and your people, you don't count. The only goal remains the development and well-being of your people. Long live the President of Burkina, His Excellency Ibrahim Teore. Long life to President IB and his entire work team. Thank you to the Burkina Faso people for the frank collaboration. Long live the AES. Now let's take one more reaction from the USA, and we will round it up. Here it comes. This is what we call working for your people. To be able to do this, you do not have to have a second residence in Europe. Do not have a bank account abroad in European banks. Do not have an address book of Western politicians. You simply have to be a compatriot from among the people and love your country. President Ibrahim Teore shows the way. Well done. I must put you in my prayers. Man of peace, bravo to you. Long live Ibrahim Teore, the super president of Burkina Faso. There are reactions from every part of the world, and we could not include all in this video. But we request one thing of you. If you love what is happening in Burkina Faso, please say something in our comment. It will give us the motivation to go all out and bring to your viewing pleasure the great things happening in Burkina Faso. You see, our desk is full of reports of the activities of Ibrahim Teore. One thing is certain. With President Ibrahim Teore, there is never a dull moment. Burkina Faso's healthcare investment is setting a new benchmark in the region. Compared to neighboring countries, this initiative stands out for its scale and comprehensiveness. While other nations are also making strides in healthcare, Burkina Faso's approach is notable for its focus on rural accessibility and technological integration. This investment positions Burkina Faso as a potential leader in healthcare innovation within West Africa. By prioritizing healthcare infrastructure and accessibility, the nation is not only addressing its own challenges, but also inspiring other countries to follow suit. The long-term impacts of this healthcare investment are promising. By strengthening the healthcare system, Burkina Faso is laying the groundwork for sustained improvements in public health. Over time, we can expect to see reductions in disease prevalence, improved maternal and child health outcomes, and a more robust healthcare workforce. The government has already outlined plans for further healthcare improvements, including continued investments in infrastructure, training for healthcare professionals, and the expansion of telemedicine services. However, challenges remain, such as ensuring the sustainability of these advancements and addressing any remaining gaps in healthcare delivery. In conclusion, President Ibrahim Teore's $24 million health equipment investment is a transformative step towards a healthier, more equitable Burkina Faso. By bringing healthcare services closer to the people and leveraging technology, this initiative promises to improve health outcomes, boost economic development, and enhance the quality of life for millions. As Burkina Faso embarks on this new chapter, continued support and development in the healthcare sector will be crucial to realizing the full potential of this visionary investment. Let's keep our eyes on Burkina Faso as it paves the way for a brighter, healthier future. As always, I appreciate you tuning in and letting me break down these complex geopolitical topics. Let me know what you think about this excellent development in the comments below. Looking forward to that discussion. Please like this video, share it, subscribe to our channel, and we will be most delighted to bring you more in our next videos.